So you've all seen the news this morning, breaking overnight. Liverpool is to start a brand new pilot scheme here in the city of Liverpool, mass testing, the first city in England to do so. Everyone is eligible, symptoms or no symptoms. You can get a test from Friday. Matt Aston, Director of Public Health, really busy day. Thanks for chatting to us. Just explain in your words how important this is for the city of Liverpool.
Hi, AJ. So, look, this is a really great opportunity for us. We know that to reduce the transmission of COVID-19, you've got to identify those people who are infectious. That makes sense. And if you identify people who are infectious, you can break those chains of transmission. What we also know, though, is that national research from University College London and from others shows that potentially up to 75% of people who test positive for the virus are actually asymptomatic. And that means finding those people in the first place becomes crucially important. If we can find everybody in the city who's got the virus and then make sure that everybody does what they're supposed to according to those test results, we can break the chains of transmission and we can come out of national lockdown in a really, really strong position.
Why Liverpool, Matt, and who decided Liverpool as this first city?
So this has been absolutely driven by us right the way through. So Liverpool has prided itself right the way through the pandemic on taking that really proactive and preventative approach to keep our community safe and to keep our city safe. And a great example of that, Jay, over the summer was Princes Park and the work we did around that community, really strong community leadership, strong community ownership, and getting large-scale testing within that ward to drive down the levels of infection and to get that outbreak under control in less than 3 weeks. So this is no different from the approach we've been taking right the way through this, trying to be proactive, trying to be preventive and bold in our approach, because ultimately this is about keeping the city safe. So when we've been in our recent negotiations with government around the levels of infections and the enhanced public health interventions that have been required, we specifically requested access to new testing technologies, new testing strategies, and we've been starting to work on those plans over the last month or so. I'm absolutely delighted that the government has seen our approach, appreciated what we can do, appreciated our willingness to go the extra mile for our residents, and has decided to work with us on this.
So how will it work, Matt? Lots of talk on social media, people thinking that we're all going to be forced to get a test, for instance. Just explain to us logistics. How does it work from Friday? What happens?
Okay, so we're working up the plan at pace, and we'll release more details around the exact plan at the end of the week, and that will therefore include how people go about getting tested. But in effect, we're going to have large-scale testing facilities available to the city. This is not about forcing anybody to get tested. Why would we do that? It's absolutely not about that approach. It's about allowing that testing of people to happen regardless of whether you've got symptoms or not. And there's a personal motivation there. It's about helping people to get their lives back to normal in as quick a time as possible. So that might be around allowing people to go to work, allowing their people to go to school, or allow their kids to go back to school. It might be about allowing people to go and see their nan in a care home. It might be about making sure people get access to the health services they need to. It's certainly about protecting our frontline services. So this is not forcing anybody to do anything. It's actually giving people the tools they need to help them live their lives as normally as possible.
And this is the thing we need to get across. You know, this could get us out of tier 3 lockdown, for instance, after this national lockdown a lot earlier.
Yeah, exactly. That's the game changer here. This is, I mean, you know what? We've been living with COVID all 2020, and 2020 has been a hard year. It's been a hard year for me, and it's been a really hard year for most of our communities. You know, none of us have been unaffected by this. So of course we want to get life back to as close to normal as possible. But there's a reality here, Jay. COVID-19 has not gone away, and it's unlikely to go away in the foreseeable future. What this does is give us the tools to help us manage living with COVID-19 in the best way possible, so as close to normal as possible. So currently we have PCR testing available. We've got a couple of sites in the city where if people are symptomatic, we ask them to go and then they get a swab that's back of their throat, up their nose, put into a test tube and posted off to a laboratory. We're going to have a lot more of those units dotted around the whole city that people can make appointments to go to and turn up and get tested. And that will happen the same way, tests within 2 days, and advice and support around what people need to do based on the outcome of that test, regardless of whether you've got symptoms or not. But the game changer here is these different type of tests that are called lateral flow tests, which is, it's almost like pregnancy kit type technology. So it's still a swab at the back of the throat and up your nose, put into a liquid, and the liquid is put onto this test that will tell you the results within 20 minutes. Now, that isn't self-service. There'll be people who will do that test with people, with you, but then you'll get the result very, very quickly. The results will go into the national system, which allows us to do the kind of the contact tracing and the wider support type stuff, but people will know straight away whether they're positive or negative.
And then it's all about those people self-isolating for that period that they need to. And obviously more people will be doing that, because I'm presuming there'll be more positive tests known within the city.
Yeah, so there's national estimates of prevalence right the way across the country. Northwest is no different. So there's an estimated prevalence of around 4% of our population. That actually matches reasonably closely to the number of positive cases we're seeing. But this is a case finding exercise. So if you go back to that kind of asymptomatic transmission, there will be cases out there that we just don't know about. So hopefully, if we get this right, we will pick up on more asymptomatic cases. So we'll have initially more positive cases and more people doing the right thing. But in quite short order, actually, those rates will come down because you'll break the chains of transmission and come out the other side. So we're entering a national lockdown on Thursday. Whether we like it or not, we're going into a national lockdown. We will start to put in place these new testing arrangements from Friday. And so if you think about kind of a 10-day self-isolation period, if we and the ability for us to test huge amounts of people in a week, you know, by the middle of this, by 2 weeks into national lockdown, we could start to see the results of this coming down the other side.
Okay, the word regular, Matt, I won't keep you too much longer, but the word regular, people saying that you can get regular tests. How will that work? Is it a weekly thing? Is it a daily thing? How will that work?
Yeah, working out the details, so I haven't got the exact details, but it's more likely to be much more like weekly than daily, and it doesn't mean everybody has to be tested every week. So certain groups might be tested more frequently to allow them to undertake certain activities. So if you think about our frontline emergency services, you think about kind of fire, police, and the ambulance service, who are all under huge pressure because of the amount of stuff that's going on, but also because of, you know, sickness absence rates and just people suffering themselves from COVID. This gives us an opportunity to maintain those frontline services in a much better way, and that's where regular testing really comes in. But the same equally could apply to schools, to care homes, and to our frontline health services.
Okay, and we just need to talk about the army, Matt, because again, lots of people talking about this on social media. The army are brought in to help with the testing, aren't they? That's how that's working.
Yeah, absolutely. So this is a really interesting one. So, you know, it isn't the army patrolling the streets of Liverpool. One thing you need to do mass testing, well, there's a couple of things you need to do mass testing. One is high prevalence in the area, which we know we've got. One is a good test with good sensitivity and specificity, and both these two technologies give us that. And then the third one is the logistics, the ability to do that mass testing without drawing on all the other resources we've got in the city and taking them away from their usual day-to-day job. So this is the fantastic opportunity the army gives us. Army logistics, rolling out those tests to the city, helping with the testing, making sure everything runs smoothly. It's not soldiers on the streets, if that makes sense.
And we'll get more info, I presume, with you guys on Friday for what's next.
Yeah, later in the week we'll start announcing the plans for exactly where the testing sites are.